Hello and welcome to Autism Specialty Care Education Series, which has been brought to you by India Autism Center and Neuroabilities Healthcare. Through this webinar series, we hope to cover a wide range of topics and provide comprehensive evidence-based information to assist educators and families in developing effective educational programming for their children and students with ASD. I'm Sakhi Singhi, Project Coordinator at India Autism Center, a first of its kind integrated community project coming up in Bengal in India. You can know more about it by clicking on the links in the chat box that I'll be sharing shortly or following our social media pages. I'll also be attaching India Autism Center's brochure for your perusal. We also have here with us today Sandra Bean Lewis, Director of Marketing and Community Affairs at Neuroabilities Healthcare, which brings together the experts needed to provide evaluation, diagnosis, and treatment for individuals across the lifespan with neurological, behavioral, developmental, and cognitive concerns. This webinar series highlights many of the specialty care services of neuroabilities and the experts who work together to bring patients of all ages personalized care. Today's webinar is by Dr. Hilary Murphy. Dr. Murphy is a licensed clinical psychologist and formerly trained pediatric neuropsychologist with specialization in neuropsychological assessment of developmental and medical disorders. Dr. Murphy has extensive experience evaluating children, adolescents, and young adults. As part of her training, she participated in interdisciplinary treatment teams on an inpatient and outpatient context to treat clients presenting with a variety of neurological, neurodevelopmental, and psychological needs. Her training in school psychology provides her with expertise in collaborating and consulting with educators and other professionals to develop comprehensive, individualized educational and treatment plans. She adopts a multifaceted approach to neuropsychological assessment, which takes an individual's culture, social, emotional functioning, cognitive profile, and academic performance into account to develop a holistic understanding of each patient's unique presentation. She previously served as an adjunct professor for Fordham University's Graduate School of Education and has published research on the utility of specific neuropsychological measures in children with epilepsy. Her areas of expertise include ADHD, dyslexia, and other specific learning disabilities. Dr. Murphy's talk is on Dysregulated and Dysexecutive, supporting students with autism, ADHD, and executive dysfunction. We'll begin the webinar today in just a moment, but know that we'll be fielding questions towards the end of the session. However, you can ask them anytime by clicking on the chat box below. When you click on the chat box below, please address your questions to the moderator. We hope to have your questions answered towards the end of the session. If you have any general questions about IAC or neuroabilities, you can address them in the chat box anytime during the presentation. There's an e-certificate of attendance for this webinar, and we'll be sharing the Google link before the question and answer session. It is mandatory that you fill the link within 24 hours. Questions about e-certificates are taken on email or WhatsApp, and the contact information will be shared soon. According to our latest webinar policies, participant video will be permanently stopped if it appears to be unclear or distracting. We'll be locking the meeting in the next 10 minutes. Thank you all for joining us today, and thank you, Dr. Murphy, for being a part of this presentation.
Thank you so much. I'm so excited to be here with everyone this evening. So I'm going to quickly share my screen so that we can follow along with the presentation. Now, one of the things that I always like to begin my talks with is discussing what a neuropsychologist is, because invariably whenever I have a client come into my office, the first question I usually start with is, do you know who I am, what I do, and what today is going to look like for you? And either I get a little bit of a blank stare, or I have people saying, I'm really not sure what exactly we're going to be doing and how you fit into the evaluation process. So a neuropsychologist is essentially tasked with looking at all areas of cognitive functioning, including general intellectual skills. We look at language, both expressively, receptively. We look at the social use of language, fine motor and visual spatial skills, processing speed, attention and executive control, essentially what we're going to be talking about in depth today, memory, academic performance, and social emotional functioning. And we take all of that information and put it together to devise treatment programs for individuals from adolescents, young children, adults, to make school a little bit easier, to make home life a little bit easier, to help the individuals who come into our practice to achieve the goals that they have set for themselves. Now, when we talk about executive functioning, it's important to point out that it's a very wide-ranging term. It encompasses a lot of different skills, and within the academic community, there's a lot of discussion and some controversy as to what exactly executive functioning means. I take a very holistic approach. I think of it very generally as any higher level cognitive skill that's required for goal-directed behavior. So thinking of things like emotional regulation, mental flexibility or shifting, working memory, organization, the regulation of attention, all of these different things that young children and adults need in order to be successful and to achieve the goals that they've set for themselves. Now, as we'll discover throughout the talk, we see this developing along the lifespan. We really see a lot of spurts of growth in these cognitive skills that start as early as infancy and continue throughout our young adulthood and adulthood. And it's why for some people we can see this uneven pattern of development, and why sometimes otherwise very capable individuals can struggle. And I think the reason I like to talk about this subject is that for many parents who come into my practice, they'll talk about the fact that they just don't know why their child isn't hitting the mark, why they've done all of these other things to help to support them. And for some instances, the children will talk to me about the fact that, I don't know why I just can't get it together, if you will, why I just can't meet the expectations that are being laid out for me. And in some instances, it's because some of these skills aren't fully developed. Now, the reason that I like to talk about this in the context of ADHD and autism is that we know that for children with autism, these deficits in attention and executive control tend to come part and parcel with that diagnosis. So much so that years ago, and really up until more recently, it was essentially considered that you couldn't diagnose ADHD and autism together. These difficulties were so pervasive that you would expect a child with autism to have some level of attentional impairment. And there's still some discussion there about how much impairment we have to have a comorbid diagnosis. But certainly we know that for many individuals, even generally neurotypical people, we can benefit from better understanding these facets of executive functioning, how they contribute to our achievement, both scholastically and academically, as well as just social, emotionally, and interpersonally, and just better understanding that everyone develops at a different rate. And we can help to support children to build these skills over time, because we know that for executive functioning in particular, the best thing that we can do is to build these skills and to model them. A lot of times I like to emphasize to parents that you have gotten through adulthood and you've developed your own methods for managing your organizational and career expectations. Well, we have to model that for our children, both in the classroom and at home. So let's jump on into what I want to discuss today. Now, like I said before, there are a lot of different skills that fall under the umbrella term of executive functioning. These are some of the most common ones that you'll come across both in the educational literature and in just general kind of pop psychology, if you will, in the common kind of language. And they include things like planning, time management, behavior monitoring, and you'll see that they range from the more concrete organizational skills, like how do I organize a calendar? How do I plan for a long-term assignment? To more social emotional, being aware of how our behavior impacts those around us. Now, we're going to talk about some of these things in more detail, but I always like to start with the fact that we see different skills manifesting differently either at home or in school, so either academically or socially. And that tends to be how I think about these things. It's not just in school that we see them occurring in a lot of different contexts, and they can look different. So a lot of times when I'm talking with parents, the reports that I'm getting about what's hard at home are going to be very different about what's difficult at school. Now, I had mentioned a couple minutes ago that this is something that develops throughout the lifespan. For many years, there was this misconception that executive functioning in particular really didn't, come online, if you will, until much later in adolescence and childhood. And we really know that that's not 100% true, that the foundational elements of these skills start to develop as early as infancy. So if you've ever seen a baby, a young child looking at something like, I always think of the example of a mobile, above a baby's head, or a baby attending to someone in their environment. If you're cooing at them and talking to them and they're looking right at you, they're paying attention to you. Well, that's attention regulation. That's that baby focusing on you and you alone and ignoring other things in their environment. Well, that's a foundational skill that later then adds to what we think of as sustained attention in adolescence and childhood. What we also know is that as this develops over time, we see different spurts. So these kind of growth spurts, if you will, in these skills, they tend to occur around preschool, surprisingly enough, and then later elementary school. And for many students, it's interesting that this then corresponds with the increased demands we have academically for them. In late elementary school and in early middle school, oftentimes we're expecting children to become more independent. We want them to know what's expected of them. We want them to be able to complete their household chores without being told several times, to know certain routines, to be able to recognize when their actions may have a negative impact on those around them. And again, if we're thinking of the context of autism and ADHD, we know that those are areas that are very difficult for these children. So this is why when we're starting to see issues crop up, we look at certain developmental periods. Oftentimes when we're assessing something like autism, we talk a lot about the period of time between the ages of 4 and 5. And a big piece of that is that we know that there's a tremendous amount of psychological and cognitive growth that occurs there. And it's also the first time that we can see some of these more subtle issues starting to emerge. Difficulties making friendships with other children, following routines, whether that's in daycare or at home. And again, if we think of why we develop certain measures the way we did, well, this is why. We know that it's something that happens over the lifespan. It's not that a young adult wakes up on their 18th birthday and suddenly they have all of these new skills. They're things that slowly develop over time. And it's why when we start talking about some of the interventions and treatments that we can try to put into place, it's why it's important that we intervene early on, because the earlier we build a skill, the longer the child has to develop that and use it in their life more generally. Now, thinking about the models, I'd mentioned before the fact that there's a lot of discussion within the academic and kind of environment and community about what exactly executive functioning is. I'm not going to bore you with all of the details of that because it can be very dry. The long and short of it is that there are three main things that tend to be consistently agreed on within the literature. Those include impulse inhibition, so the ability to kind of stop yourself from acting on an impulse or stop yourself from acting on an urge, kind of thinking your behavior through. Working memory, which we're going to talk about a little bit later, kind of just being able to hold information in our mind and manipulate it. And shifting or mental flexibility, which again is very important when we talk about children with autism, because we know that rigidity, that adherence to sameness, that difficulty with transition is a core piece of what interferes with a child's functioning socially and academically. It's something that is very difficult for a lot of children to deal with and a lot of families to deal with. So those are the three things that tend to be agreed upon. I'm going to talk a little bit more extensively about other areas, just because I think laying a foundation is going to be very important for why we develop certain interventions. Now let's talk about the basic, which is just attention. We use that term a lot, but we don't really go in depth into what we mean when we talk about attention. Attention isn't just our ability to focus on one thing. So for example, right now, you're probably focusing on my voice, you're focusing on my slides. Well, that's a form of attention. But there's a lot of other processes that you're doing that you might not even be thinking about. You're also ignoring anything else in your environment that could be distracting. So there's a window behind me. I'm not being distracted by what might be going on outside that window. I'm not distracted by the dog that I hear barking outside my door. Again, I'm not just focusing. I have to also filter out all of these other things that could distract me. And that's a key piece that children with ADHD struggle with. They really struggle with how to filter those things out and how to determine what is most important in their environment. So think about a noisy classroom. A child who has ADHD has difficulties prioritizing the teacher's voice, the instructor's voice, over perhaps the two people behind them that are whispering about something, or the noises that are going on outside the classroom, or the child across the room who's tapping his pencil on the desk. So you can see there's a lot of different things that are going on that all fall under this umbrella of attention. And there are actually a couple different forms of attention that, especially neuropsychologists focus on. So there's something like attention span, which is the most basic, simple form of attention, kind of several seconds, just holding something in our mind. There's focused attention, like we talked about before, you determining this is what's important in my environment right now. I want to listen to this webinar and get the information from it. And there's also things like alternating or divided attention, which is the most complex, being able to focus on two things at a time. Now, it's not multitasking. A lot of people, when I talk about this and when I talk about mental flexibility, will say, oh, well, you're talking about multitasking. Multitasking isn't really effective. But think about if you're cooking a big dinner. You have a lot of different pots on the stove. You have to attend to the timing that you need for one dish as opposed to another. You have to listen for the oven, because when the oven goes off, you have to remove what's in there and shift it around. So again, that's focusing on a couple different things. You're not cooking on the stove and pulling something out of the oven. You're shifting, focusing on what's on the stove, focusing on what's in the oven. That's what I'm talking about here. That's what something like divided attention really is. I also like the example of taking notes. If you're taking notes, you're dividing your attention between listening to the presenter or instructor and then looking down and actually transcribing or writing down what you want to remember. Those are two different processes. They're equally important, and you're not really doing them at the same time. It can seem very seamless for a lot of people. You can see people watching someone talk and writing at the same time, but it's still two different things. So again, we see that this is a lot more complex than we tend to give it credit for. And it's why children can struggle in different areas here. Children can have difficulties in different kinds of attention, and that can tell us a lot about how we can intervene. Now, impulse inhibition is another thing. The reason I like to talk about this is because it's usually what brings people into my office. It's the most obvious or overt sign of an attentional difficulty, is the child who can't stop themselves from acting on impulse. And this impulsivity can come out in a couple different ways. It can be physically impulsive, a child who can't stop, touching other people, grabbing things off of a shelf, things like that. It can be verbal impulsivity, interrupting a conversation, having difficulties waiting your turn. And it can also be emotional. So think of emotional reactivity, a child who has what I like to think of as knee-jerk reactions to emotionally charged situations. A child gets mad or upset because someone takes a favorite toy, they push that other child. That's an impulsive kind of reaction. They might not be an aggressive child, they might just be a very impulsive child, not thinking through the fact that it's not okay to put our hands on someone else. Or a child who has large tantrums over seemingly, not very troubling things, being asked to do chores, being told no. And again, it's that impulsivity there where a child can't stop themselves from acting on that immediate emotional impulse. So again, impulsivity is another kind of wide-ranging topic that bears a lot of thought when we're trying to consider what we want to intervene with. Monitoring is another part, and there's two facets to this. There's performance monitoring, which I think of as being very academic skills based. It's knowing how well we are doing a particular task. So a child who is monitoring how well they're completing a writing assignment, going back and checking their work, making sure that they have accurate capitalization or punctuation, that they're writing appropriately. They're not just rushing through it. They're actually making sure that they're doing a good job. And the other piece of that is behavioral monitoring, understanding that our actions cause reactions in other people. Now, we don't always think about this, but whenever we're talking or engaging with others, we're watching their reactions and we change our behavior based on what they do. Say, for example, I was presenting to everyone in person. And as I was talking, people were looking away, they were looking disinterested, maybe they were giving me these nonverbal cues that they weren't engaged. I might change the way that I'm presenting in order to get their attention back. As opposed to if I look and everyone seems very engaged, is nodding, is giving me all of these nonverbal cues saying, oh, we understand what you're saying, I might continue on with that behavior. Now, again, in autism, we know that that can be a skills deficit for children. Paying attention to these nonverbal cues, facial expressions, body language, this big piece of information that we use to communicate with other people. We know that children with autism can struggle with that just, at baseline, but also it can be compounded by the fact that this is an executive function where then what do we do with it? So in many instances, when we have social skills training, we can teach children what certain facial expressions mean, what certain tones of voice can mean, and especially higher functioning children can really benefit from that. But then it becomes, what do I do with that information? And that's where some of the behavioral monitoring comes in. And it can be a little bit more difficult and a little bit more nuanced to teach them what exactly we do. Now, set shifting, again, I'd mentioned that before. This is really just being able to shift between two tasks. Again, I really like that example of taking notes because I think it really encompasses what this gets at. These are two things that are equally important to us, but it's also the fact that we are able to adjust to unexpected changes or transitions. Say our schedule changes and we have to do one thing, out of sequence. Say we typically will, stop for lunch early in the morning before we go to work, but something happens with our car and we know, okay, well, I have to take care of this first, then go to work, and then I'll get my lunch later. So again, just being able to think on our feet and transition and accept that there are changes in our environment that we may have to attend to in the moment. And again, that ability to be mentally flexible is a core feature of autism, where children will struggle with, how do we make this transition? This is where a lot of parents will talk to me about big tantrum behaviors, because a child becomes upset and frustrated if there are small changes to their daily routine. They do well when we kind of stick with what we know, but we all know that life doesn't always work that way. So being able to teach children, what do we do when the routine changes, is a big piece here. Yes, we want to kind of establish some sense of predictability because some pieces of this can come from anxiety in children with autism. It becomes very upsetting and anxiety producing that things change and we don't understand why. But we want to build in the coping skills for what to do when that happens, so that a child doesn't become incapacitated, doesn't really get upset and not know what to do. And now working memory. Working memory is a huge part of executive functioning. It serves a lot of different purposes and it has a couple different component parts. Essentially, there's one piece, the phonological loop, that works primarily with auditory information. Think of remembering a phone number that someone says to you, just holding it in your mind, maybe repeating it a couple times until we can get to the phone and dial it. There's also the visual spatial sketchpad, which deals with more nonverbal information. Think like mental math, being able to quickly calculate change in our head. There's also the episodic buffer. This is essentially the holding place where any information is stored until it is either forgotten or it's transferred to long-term memory. So our brains kind of hold information. Let's go back to that example of the phone number for a second. Say we repeat that over and over and over and over again. We rehearse it. Well, then that's going to get translated into our long-term memory because we've practiced it over time. It's why we have that idea of like practice makes perfect. We want to go over the information we've learned previously to make sure that we remember it over time. Well, same thing here. This is where the information is stored until it gets to long-term memory. And all of these processes are kind of overseen by what's thought of as the central executive, essentially the highest functioning piece that either stores things in different areas, kind of determines, okay, we've been rehearsing this information, it's time to move it into long-term storage, but also manages all of the information that's coming in. So we know that there's a lot of processes here that are all kind of functioning together. And again, a lot of times we're not thinking about these things. They happen seamlessly. We only pay attention to them when we struggle with it. We only pay attention when it's something that gets in our way. And it's also why for many individuals who come into my practice and we'll talk about attentional weaknesses, they'll say, I feel like I have a memory problem. I feel like I forget things a lot. Well, it's usually not a memory issue. It's more often an attentional issue, that perhaps we didn't rehearse the information enough, or we weren't paying attention enough to begin with, so we never really learned it effectively at the get-go. So many times I say to parents, it's not the fact that your child has a memory deficit. Those are pretty rare in children. It's more the fact that the attention is getting in the way. We have the capacity to remember, but we're not learning effectively. Now, task initiation is another big one, especially for older kids. A lot of times parents will come into me and say, oh my gosh, I have to repeat myself so many times to get them to start something. Something as simple as take out the garbage or take care of your room and clean things up or get started on your homework. It becomes a battleground because I always have to prompt them and they won't start anything unless I'm standing right there. And a lot of parents will say to me, I don't understand, because if they just got started on it, if they just did it, it would be done. It would take less time. And there's a couple different features of task initiation. It seems very simple. Just get started on it. If we have to get something done, let's get it done. But there are a couple different levels that can, explain some interference here. So task initiation is just being able to get started on the things that we have to finish without prompting. As adults, we know that we have to do that all the time. If I have to get my laundry done, well, I have to go down and finish it. If I have to get a certain report done for work, well, I have to finish it. And I don't need someone standing over me reminding me that I have to do it. Now, a lot of times children who have weaknesses in task initiation seem oppositional. They seem defiant. And this causes a lot of tension in the household. More often than not, when we dig into this, while oppositionality and kind of that defiant behavior can be a part of it, when I think of children who have more of a dysexecutive quality to their functioning, they really have primary deficits here, it's usually because they don't know where to start. So let's take the example of cleaning your room. When parents come to me and they'll say, oh my gosh, they procrastinate. All that I've said is clean your room. So just, I want them to go in and clean their room. To a child, they might stand in front of a messy room and not know where to start. Do I start with the clothes that are on the floor? Do I put away my toys? Do I organize my laundry? Do I put everything in the closet and just hope that mom doesn't open the door here? Again, it seems like a bigger task. But if we break it down and say, I want you to go in and take all of the clothes that are on your floor and put them in the hamper, that's a direct thing. So breaking things down in some instances can be very helpful for these kids. But there's also the idea that for people who procrastinate, people who put things off until the last minute, there's this disconnect, this difficulty in estimating how much time we have to do something and how much time it actually takes. That's a big part of it. People really will believe that they can do something much faster than they really can. So let's go back to the example of a student with, let's say, a book report or an assignment for school. They might look at that assignment and say, I could do that in 10 minutes. When in reality, it's a research paper. And a research paper takes a lot more than 10 minutes. Some other people will say to me, well, I work better under pressure, especially college students who come into my practice. They'll say, I leave things till the last minute, I do an all-nighter, and I work best under pressure. And oftentimes I'll say, for now. Because eventually what we know is that these skills that we've built over time, perhaps what got us through elementary school or high school, secondary school, stop being useful once we hit the level of a university or a college. It's not effective. And it's why a lot of times students who are very, very bright, very capable, who can get through the academic work really start to struggle. I see this a lot in my practice. And usually that's because we want to put things off. because they make us anxious. Let's face it, none of us are like, oh, you know what I would like to spend my weekend doing? Oh, an assignment for work or an assignment for school. But also we have to remember that there's a piece here that involves anxiety, and we'll get to that in 1 minute. The last thing I want to talk about with respect to procrastination more generally is the fact that it can be difficult for us to resist short-term rewards here. What do I mean by that? Well, we can get distracted by other things. Let's go back to the cleaning the room example. Child might start cleaning their room, then say, I'm going to take a break and go on Facebook or Instagram or whatever. I'm going to play my video games for a couple minutes, a highly distracting task. And guess what? That becomes a time suck. So we'll focus on these short-term rewards rather than getting something done and then rewarding ourselves. And that's why when we talk about taking breaks a little bit later on, when we get to intervention, I'm going to be very specific about what those breaks should include. And anyone who's kind of worked on a college level project or has seen a student work on that knows the minute that we get on our cell phone or something distracting, it's over. We're done. All of a sudden we look up, it's been 45 minutes and we don't have anything done. So let's go back to that idea of anxiety. Why do I talk about anxiety when I'm thinking of procrastination? Well, a big part of it is because we tend to avoid tasks that make us anxious. So if we look at something and say, oh, it's really, really difficult, I don't know what I'm doing. Let's say a child who doesn't like to write or do homework, well, they're going to try to get away from it. There's a relief that we feel when we avoid something. And it's that sense of relief that starts to make us avoid things over and over again. Think of the example if you have plans with someone and you really don't want to go, and then suddenly they cancel those plans. It's like, oh, it's such a sense of relief, right? Well, oftentimes that sense of relief is something that a child will feel when they're avoiding something that makes them anxious, like a school assignment. So they put it off and they put it off, and then all of a sudden they don't have any more time to put it off, and then it becomes a crisis. And it's because they are continuously reinforced. They seek that feeling of relief of putting something off because they don't want to have to do it. And again, this isn't a child being defiant. And oftentimes it's not something that's conscious. The child doesn't know that that's what's causing them to put things off. They just know it makes me anxious. I don't want to think about it. So I'm not going to think about it right now. I'll deal with it tomorrow. I'll deal with it tomorrow. And again, then tomorrow becomes the next day, the next day, the next day. And we have a child who never gets anything done. Now, with respect to academics, we know that these executive functions start to have a really significant effect on academic performance as early as first grade. It's not just the fact that these are the skills that help a child plan for long-term assignments, check over their work for mistakes, keep in mind how well they're performing as they go, also organizing themselves, knowing where their pens, pencils, rulers, where their homework assignments are in their book bag, things like that. It's also the fact that as children get older and as academic demands increase, we see the demand for executive functioning start to increase also. So in the example of reading, when we're reading a chapter book, a child has to hold all of the plot information in their working memory. So they have to know who's in the book, what's going on. They have to rely on long-term memory to make predictions about what might happen next in their abstract reasoning skills. They have to focus on the book and ignore everything else that's going on around them. You can see all of these processes working as one so that a child just can read a chapter in a book. And if you have any deficit at any level of that functioning, say a child is distracted by something, well, then they're going to really struggle. And this is oftentimes the child who will come in and their reading scores are fine, but they'll say, I have to reread things several times just to understand what's going on. Or I get to the end of the page and I don't know what I was reading. I kind of lost my place. It's because there's an executive functioning deficit. Same thing with writing. Written expression is very demanding because the child has to decide what to write about, has to put all of the points in their essay. They have to, again, pay attention and ignore distractions. And also it's our working memory skills that keep all of this information in our brain as we transcribe it, as we actually write it. So if you've ever been sitting at your computer kind of trying to figure out how to word something, it's all your working memory putting those sentences together. And if you have weaknesses there, it's going to take you longer. It's going to be more effortful. So again, it's not that a child can't do it. It's not that a child has a learning deficit. It's that it is far more effortful because the executive functioning skills aren't there. And the same thing with mathematics, especially when we get to multi-step equations. I see so many kids who are very capable in math, but when they have to, let's say, read a word problem and decide what the most appropriate operation is, or sequence their steps, or write neatly so that they don't miss a step, that's where I see the issues. And that's coming from the kind of executive functioning domain. So we've talked about some of the academic impacts here. So it's not just the fact that they can't manage their workload, they can be forgetful. These are the children who will walk in and think that something is due on Tuesday when it was due on Monday. And they're just like, oh my goodness. Like I think of the deer in headlights example, a child that just stands there and is like, oh my goodness. And again, for many individuals, it can cause a lot of anxiety and a lot of frustration from adults and the people in their lives, because these are otherwise capable children. And children can sense when we as adults are getting frustrated. Parents will say, you know, why can't you just get this done? Teachers will say, you're not paying attention, you're not doing your best, you're not giving me your best effort. And this is why a lot of times kids will come in and talk to me about feeling anxious. And again, when we have a child who has autism and ADHD, we see this becoming very, very difficult because they have a dual diagnosis. And this is something that's getting in their way despite having other areas of strength. So let's talk about what we can do about it, kind of wrapping it up. And a lot of, you know, my interventions here, they're a little bit general because every child is different. Every child is going to need a different level of support depending on their level of functioning. So when I thought about how we could best support them, I tried to give as many recommendations that I can from the perspective of the classroom and the perspective of what we can do at home. And the first part of it, I think, is establishing what are the strengths that a child has and how can we build advocacy? How can we teach them when it's time to ask for help? Because a lot of parents will say to me, I don't want my child to be dependent on me. I don't want them to learn that they have to have someone sitting next to them. I want them to be more independent in using these strategies. And that's appropriate as kids get older. But at first, they're going to need a lot of help, and they need to feel comfortable asking for help. Because when we think about the fact that some kids may already be walking in feeling nervous, feeling bad about themselves, feeling like, oh, I just don't try hard enough, I'm lazy, I'm not motivated, whatever they start to call themselves, they're less likely to ask for help. They're more likely to give up. So we want to say, I'm here to help you, and I'm here to teach you what you can do to get around this. And part of that is advocacy. So having a child feel comfortable asking for help from teachers or from parents, building on our strengths and emphasizing when a student is using the strategies we're teaching them. Hey, I saw that you filled out your homework log today. Nice job. You know, oh, you got your homework done. I didn't even have to remind you. Great job. Little things like that, that again, can just help to build up a child's self-esteem and also praise them for doing a good job. We all like praise. We like when people recognize that we're working hard. Well, children are no different. And also connections, having this accepting environment for a lot of different learners and knowing that students are going to develop these skills at their own pace, even when we're helping them, even when we're assisting them. It's going to take time for these kids to build these behaviors, and that's okay. That's absolutely normal. Now, within the classroom, a lot of times I think of things like preferential seating. If we have a child who we know is highly distractible, where the best place to put them is close to the teacher, where the teacher can keep an eye on them, where they can see, is this a, you know, is this person, you know, staring at the window, or are they paying attention to me? Having nonverbal cues. Again, we don't want to punish a child who's getting distracted, but we also want to make sure that we can refocus them. And a lot of strategies from teachers that I've talked to in the past, they'll say to the, you know, kind of pull the child aside and say, when it looks like you're not paying attention, I'm going to walk past your desk and I'm just going to tap my hand on your desk. And that means I want you to focus. Well, that's a really powerful cue because it doesn't single a child out, but it also recognizes, let's say the child's looking around the room and really not paying attention. It's time to focus. Allow for motor breaks. That can be class-wide. That can be giving this child little tasks to do around the classroom, like passing out pens or pencils, taking messages down to the office, anything like that where a child can get up and move around. Because again, we expect kids to sit and pay attention for long periods of time. And I know as an adult, that can be difficult for me, but I have the luxury of being able to stand up at my desk, stretch when I need to, and things like that. Well, children are no different. So knowing that a child may have to get up and move around, and if we give them little tasks to do, it also gives us a nice opportunity to praise them for when they're doing a good job, which can be very, very powerful. We know that a lot of children who have these kinds of behaviors, well, they really start to get a lot of negative feedback from their environment. They're more likely to be the kid that a teacher may be disciplining or a parent may be disciplining because they're not paying attention, because they're not on task. So this gives them a nice opportunity to get some positive praise so that their interactions aren't, very negative with the adults in their lives. Having lists and visual aids. Multi-step instructions are hard for kids who have working memory issues. So having a consistent classroom routine that's displayed on the board, or having a visual schedule, particularly for children with autism, can really help. And a lot of times just having different icons that represent different things in their day. We're going to do reading, then math, then spelling. Well, having little things that represent that. And then also, if there's a change in the schedule, we can use that visual schedule to model that. And we'll talk about some other interventions working with mental flexibility in a moment. Having students repeat back to us what they've heard to make sure that they understand and they didn't miss out on any instructions, and also using things like a backpack checklist. We as adults use to-do lists all the time. I see people using planners or apps on their phone. Well, kids should be taught to use a lot of those things because, again, it's building the skills now so that when they're an adolescent and an adult, they already have the hang of it. We don't have to wait until adulthood for kids to learn how to use some of these organizational strategies. Also, being good role models, having a classroom that's very clean and clear and free of clutter, and having some error monitoring strategies for each child. Again, using things like a reading ruler. If a child misses the operation sign when doing math, circling or highlighting that, just little things to help them to organize their thoughts and ideas. At home, one of the biggest things that can be really helpful is having a consistent routine for completing homework. Let's say the child arrives home right after school. They start right with homework and work for, let's say, 20 minutes and take a 5-minute break. Well, that's really appropriate. And it also helps the child to get something done. And then after that, they can have free time. It builds in a break, but it's important to remember that those breaks shouldn't include things that are highly distracting. That break shouldn't include a cell phone or going on social media or anything, because again, it's going to make it way more difficult to transition back to homework if we still have things to do after those 20 minutes. So reducing the distractions. I advise a lot of my older students to take their cell phone and put it across the room where it's accessible, but it's on silent, so that we don't get tempted to use it while we're doing something else. Have multiple sets of items that we usually lose. Pencil cases, pens, pencils, things like that. Folders are a big one. And have areas of the home that are organized. So this is where I put my backpack every day. Having a consistent routine for checking to make sure that we have everything we need for the next day. A lot of parents, we underestimate how important that can be. I know if I have to get up early in the morning, I lay my clothes out, I put my briefcase by the door, I make sure every night, do I have my laptop? Do I have my lunch? Do I have my charger? All of these little things that, again, we as adults do, we can model for the children in our lives and help them to establish that routine. And having a calendar that we look at regularly. What's coming up this weekend? Again, thinking of a child who has a book report coming up. Well, what if we have a lot of, family obligations? There are birthday parties, or there are celebrations or holidays that are coming up. Well, maybe we have to get something done earlier than the weekend rather than just waiting and then Sunday night going, oh my goodness, this is due on Monday. I don't have any time to do it. And then everyone panics, and updating it regularly. A lot of times I'll say, take time Sunday night to look at what's coming up for the week. Because again, we want to kind of review, okay, what can I expect, and what do I need to do to prepare myself? And in terms of study skills, again, having things like, how do I prioritize tasks? I'll tell a lot of my students, there are 2 ways to think about this. Either you can start on the thing that you're dreading doing, the thing that you really don't want to do, because once you start working on that, you're going to feel reduction in your anxiety. You're going to feel accomplished and feel good about what you're doing. Or you can start out with some of the faster, easier things just to get them off your to-do list. And it can depend on what we need to get done. If that task that we're kind of dreading or that's making us anxious is something that's due tomorrow, well, we should get that done and then leave other things to the side. Again, teaching children how to prioritize what's important and breaking it down is very, very, very important for these kids, because most of the time when they just don't get started, it's not because they don't want to, it's because they just don't know where to start. So we have to teach them what's the most important thing to get done and helping them to feel accomplished here. Again, I also recommend for a lot of students, whenever possible, to record things like class lectures, because for some kids, it's hard to just willpower through their attention and their distractibility, and having that in place to make sure that they can review the lecture later on can be very, very important, especially in college and secondary school. Now, with respect to some of the cognitive flexibility piece, I've mentioned the visual schedule, but this can also be used so that a student can learn what we think of as subroutines. Let's take the example of a morning routine. We wake up, we brush our teeth, we get changed, we have breakfast, we pack our backpack, we go to school. Well, let's say a child wakes up a little bit late and we have to switch things around a little bit, or things get hectic and let's say mom has to leave a little bit early, so we have to do things in a different routine. Well, that can be an area where a child can get very upset, flustered, frustrated, and then we have a tantrum. So if we know that tomorrow's going to be a change in routine, maybe the night before we go over it and say, remember, tomorrow's going to be different. We're going to wake up, we're going to have breakfast, we're going to get ready, pack our backpack, and then leave. And again, those little things, those little shifts and changes, and as much time that we can give the child to adjust to that change, the better off we're going to be. I like the idea of having a 2-minute warning whenever we have to make a transition for these children, because again, we want to prevent a lot of the meltdowns and the difficulties, and letting a child know, here's a timer, you have 2 minutes, and then we're going to switch from, let's say, playing video games to going to art class or something like that. This way they are prepared, because a lot of parents will say to me, even if it's something that they want to do, it's the act of transitioning, being able to switch from one thing to another, that's very difficult. So giving them as much advance notice as possible and using something like a timer can be very, very effective. And also an understanding that for a lot of these kids, it comes from a place of anxiety, that when things change, they're not sure how to cope with it and tolerate it. So having a very clear set of routines and letting them know, here's what you can expect for tomorrow. It's different. You have time to adjust to it, and you can always look back at your visual schedule. That can be very, very, very helpful to give them some time to adjust to that idea. Now, I want to thank the India Autism Center for allowing me to have some time for all of you today. We have some time for some questions, but thank you all for your time. I hope that this has been helpful. This has been educational, and I'm going to open the floor to any questions that have come through so that I can better explain some of these ideas.
Thank you, Dr. Hilary Murphy. Hilary, we do have a few questions. One of them is just, can you recommend some books that would be helpful? And Absolutely. That's something that we could perhaps even share later, but if you have some in your head, that'd be great.
Absolutely. So I have a couple off the top of my head, and I'm more than happy to send a list of resources that I found helpful, including books, websites, and apps on like iPhones, things like that. The first one is Smart But Scattered, which is an excellent book that's written for parents and educators and how to address a lot of these weaknesses, and has very practical examples of what can be done in the classroom and at home to help to support these students. The other one is a book called Your Kid's Gonna Be Okay, that I really love. It's written in very practical language for parents about how to set up routines at home. Now, these are primarily books that are written for children with ADHD and executive functioning, but they can absolutely be applied to children who have those diagnoses as well as autism. And a lot of it just talks about where some of these weaknesses come from, how to better understand them, and gives actual examples of real life people who have worked through some of these difficulties and what parents have done and what's been helpful and what is not. but I'm more than happy. I'll send a list of some of the resources that's more comprehensive for different age groups, as well as some of the books and resources that I recommend for parents to read to their children. Because again, kids understand when they're not doing their best. And a lot of parents will say to me, how do I talk about them having ADHD? How do I talk about them having autism? And these books can be really helpful because they're written for kids to understand some of these difficulties. So I'd be more than happy to share those.
Terrific. And we can send that out. A lot of requests for us to send it through email. So I'm certain we can do that. Okay, we have a few questions. I know we do have, Dr. Murphy needs to stop at 10, so let's get as many as we can. How to explain the importance of mental health and elements about it to people who have rigidity?
That's a really great question. A lot of times I like to use the example of, we take care of our body, and that our brain and our mind is part of our body, and that we can't expect our body to work, at the best of its ability if we're not giving it good food, if we're not taking, drinking enough water and doing all of the things that we need to do to take care of ourselves physically. Well, same thing we have to do for someone who has a lot of issues with anxiety or some of these mental health difficulties. So nourishing ourselves, I like the idea of kind of feeding ourselves emotionally and psychologically, whether that's through counseling, whether that's through self-care, of doing things that are important to us, like being creative, being, physically active, or, going and talking to someone and, finding out who we are and what we want. A lot of times I use as concrete of terms as I can. If someone is very rigid, I want to explain to them, like, it seems like it's making you really stressed when things don't go your way, and acknowledging that oftentimes we have to adjust when things don't go our way, and that's okay. And that the best way to do that is to take care of ourselves psychologically and emotionally. And more often than not, that example really helps people. For kids, when I'm recommending working with a counselor, I like to make the analogy of working with a specialty coach. If you're a soccer player, if you're a professional athlete, you work with a coach year-round to do things to make sure that you develop all of these skills. Well, working with a counselor is no different. It's just someone who's trained in, working with our mind as opposed to just working with our body. So I think those kinds of analogies, especially for kids, have been very successful in my anecdotal practice.
Thank you. Next question is, how can we help with task initiation? My son has trouble getting himself dressed in the morning, and we have to remind him many times, and it can take a long time. Any strategies?
That's a great idea. I think that's where we might want to establish a routine where, let's say we choose our clothes the night before. We lay them out, and depending on how old the child is, you might want to start off with having a visual schedule of, let's put on pants, let's put on shirt, let's put on socks, and then shoes, and then we're done. And this way we have a visual representation, and it may be that you start reminding him each step, and then slowly you let him do something on his own. Maybe he starts with just putting his shirt on, and you remind for pants, socks, and shoes. And then slowly you kind of pull that away over time. Because again, we can't expect him to just immediately start doing it. But if we break it down into each step, it can, for many kids, be a lot more accessible. And it can also take the demand off of you to remind him all of these times. Again, if we think about it as kind of not knowing where to start, well, then we're going to break it down that this is exactly what you need to do. And having that visual schedule or that reminder in his room, well, then he knows exactly what to start with and what to end with. That a lot of times can be helpful for those morning routines. And also, I really encourage you to lay things out the night before and have it be something that you do together. And this way he's ready to go. And it provides this opportunity to rehearse what you want him to do.
Okay, thank you. We have a question about an adult who's having trouble forming relationships and able to pay attention and rehearse strategies, but in the end just has a really tough time relating. Any thoughts on strategies to help someone with those deficiencies?
Sometimes with adults, I always have to keep in mind the amount of motivation that the person has. Because again, all of these skills are really dependent on how motivated we are to get a task done. So if it's more difficult for this person to interact, they might have limited motivation. So we might want to say, okay, well, what do you like? And try to get as much information as we can from that person about, do you want to talk to someone different? Do you want these relationships? And again, we know that they want to have relationships with other people. We might just have to get their input and make sure that we're not just talking at them, that we're giving them some time if they're able to tell us what they want and agree on something that they feel comfortable doing. You know, it can be hard to give really direct, interpersonal kind of interventions without knowing the individual. But many times I know if we can collaborate with the patient themselves, we can see a lot of improvement. And just also giving them an opportunity to say, is this something that's harder for you? Is it something that you want to do? What can I do? Or maybe, let's say they have a successful session where they pay attention to someone, building in a reward, whether that reward is praise, whether that reward is the person doing something nice for themselves, like taking a walk or getting a special treat or something like that. We tend to reward ourselves when we have big things that we have to do in some way or another. Well, allowing that person to find something that will motivate them and kind of push them through when it's difficult might be a nice strategy.
Okay. As children grow up, do some of these skills just happen, such as flexibility? Does a child become more flexible just with age?
That's a really good question. And you know what? It can be so dependent on the individual. Oftentimes, for some individuals, especially neurotypical individuals, people who don't have these difficulties, we do tend to see these skills start to develop over time, and we'll kind of have these eureka moments where it's like a child is just able to do something. But honestly, everybody's a little bit different. And if you have autism and ADHD, it's much more difficult, and it may not come as naturally to you as to other people. So sometimes we can see spontaneous improvements, but oftentimes we have to teach these skills, like keeping a calendar, using a planner, or any of those things. Those are all teachable skills. So children on the spectrum in particular can get a little bit more flexible with time, but they're going to get way more flexible with intervention, with appropriate therapies, consulting with a treatment team, and being taught these skills at home. So I would always say, when in doubt, intervention is the way to go, because it will only ensure that your child has the best outcome, because we can't determine how much they'll be able to do just on their own without any help.
Thank you. I think we have time for one more question. We've talked a lot about how to support our children. Any thoughts on how to support the parents in coping and supporting their children?
That's a really great question. I'm glad that was asked. A lot of times I'll recommend that parents see if they're feeling overwhelmed, if they're feeling like this is a lot to cope with, which absolutely it is. You know, raising a child in and of itself is something that can be stressful for a lot of individuals, and that's okay. And I think a lot of times parents assume like it should just be easy. I should already know what I'm doing, but there is no manual. There's no one right way to do this. And when your child has a disability, that can be even more amplified, especially if it's something that you're not sure what to do with. So feeling like you can take good care of yourself, that kind of going back to that first question of, explaining self-care, you should have things that you do for yourself as a parent, and that's okay. Giving yourself some freedom to sometimes be frustrated, especially with these behaviors, that is okay and normal. And also knowing that when you bring your child to a treatment center, asking about whether they have parent support groups, whether there are online supports that you can have, or talking to someone professionally about some of these stressors is okay, and honestly is going to help you and help your child. Investing time in yourself as an individual is going to help you to guide your child and give your child the support that they need. And that it's completely normal to get frustrated sometimes. We all do. We are all human, even parents, and that's okay, and it's normal. And you should seek the support of other parents in your area and that of a professional if you feel like it's something you're comfortable with. Nourish yourself in the same way that you would advise your child to take care of and nourish themselves.
Okay, well, it is 10 o'clock, so I want to just thank Dr. Hilary Murphy from Neuroabilities Healthcare.
Thank you so much. Thank you for your time and have a wonderful day, everyone.
Thank you, Dr. Murphy.
I want to thank all the participants for tuning in to Autism Specialty Care Education Series brought to you by India Autism Center and Neuroabilities Healthcare. If you want an e-certificate or want to leave feedback for us, please fill out the G form attached and we will send you your certificate within 4 working days. Please note that the form link is only valid till 24 hours, so make sure you fill it out within the given time frame. In case you are unable to fill out the form, please reach out to us through WhatsApp on the number given on the slide or email us at info@indiaautismcenter.org. If you would like to stay updated with the other webinars, please follow our social media handles or follow the link that we'll share to make you a part of our WhatsApp group. The recording of the webinar will be available on both of our YouTube pages within 1 month from the date of the webinar. Next week, we will be talking with Dr. Oslin Theobald about improving social outcomes for children with autism and other neurodevelopmental disorders. That is Thursday, June 25th, same time frame. We look forward to your suggestions and we hope to see you for these other webinars. Now we will stay back for a few minutes and answer any questions that you might have. Please just use the chat box to address them to us.